Hi, and welcome to another episode of the Harley Street Health podcast. And today I'm delighted to have Dr. Daniel Wai, who's an endocrinologist in Mount Elizabeth Medical Center. He's got a clinic on level 3 here. And I thought today we'd talk about diabetes and go through the basics of what it is. So hello, Daniel.
Hi, Michael.
How are you? Yeah, I'm
great,
good.
thanks.
So we're just going to have a short dialogue, Daniel, about diabetes and pick your brains a little bit about the kind of common, how it starts, how it presents. So why don't we go and start really at the basics? So what is diabetes?
Well, as everybody knows, diabetes is having high blood sugar. There are two types of diabetes. There's type 1 diabetes, which happens 5% of the time, which generally occur in children and teenagers, and where there's destruction of the pancreas, the cells that make the insulin. And then those patients, unfortunately, with type 1 diabetes would require lifelong insulin replacement injection for their lives. And then the much more common is the type 2 diabetes. And that's the 95% of all the diabetes in Singapore. And that is the one that has been going up and up. The prevalence of diabetes getting more and more. And so what happens when we eat, our body will absorb, we digest the carbohydrates like rice, noodles, and then the sugar, and then we'll digest it and into simple sugars, and then we absorb that into our bloodstream. So our blood sugar goes up, and then our pancreas will make insulin that brings that sugar down. Now, if that mechanism fails, and there's lack of insulin for whatever reason, then the blood sugar will not be able to come down, whether in the fasting state, throughout the night, the sugar is just high, and then especially after meals, the pancreas is unable to make enough insulin to push the sugar into the cells, and then you have a situation when the blood sugar is high, but inside the cells we don't have enough blood sugar. So the patients behave as though they have not enough sugar, and they will crave, especially for the sweetest food with the highest level of sugar. And then the sugar is running very high in the blood and is therefore lost in the urine. So that also explains some of the symptoms a patient with type 2 diabetes may have. So that includes fatigue, being very tired, lack of energy, and then they'll find that they have need to pass urine frequently because there's a lot of sugar that drags water out into the urine. And because they lose water, they also exhibit this thirst, and they become very thirsty. And not only they're thirsty, they also crave for the sweetest, possible to drink. So tiredness, and then because the cells cannot make use of the sugars, they also lose weight. Okay. So that's in the gist what diabetes is.
So basically, they've got lots and lots of sugar in the blood, but very little in the cells. So
exactly.
So and then they crave all the sugar, so they start getting higher and higher in blood sugars.
Exactly.
So what is happening at the moment? Why are people getting more diabetes? What's the real driver behind that, do you think?
Well, the main driver is that we are getting older as a population in Singapore is getting older. Age seems to be one of the main factors that would cause the pancreas to slowly fail. Like when we age, the organs fail slowly but steadily. So that is one of the things. The other thing that's very important is the lack of exercise. It's very sedentary lifestyle. And we have research done in the National University of Singapore. And what they found was that the total amount of energy that's spent by Singaporeans has been dropping over the past 3 decades. And that's despite people exercising more and more. If I go and exercise, if I go and exercise half an hour a day and 5 days a week, which is what we recommend, I think that, wow, I've been doing quite a good job, 150 minutes. But the rest of the time, I'm sitting in this office seeing patients, and that's really a bad lifestyle. And then I go to my car and I drive home and I sit on my sofa and watch TV. And that's unfortunately the lifestyle of a lot of people who are basically in any kind of office scenario. And furthermore, now we are in the COVID-19 situation. A lot of people are working from home. That further decrease the amount of walking, amount of exercise that we do at all. So the other thing, of course, the third thing is that food used to be quite expensive. 40, 50 years ago, when Singapore was still, sort of poorer, when we were poorer, food expenditure accounts for a large portion of the salary of the person. And now, it's decreasing, like in all developed countries. So maybe we, I don't know, spend 5 to 10, 15% of our salary on. So when food is cheap, we'll eat more of them. I mean, how much is
in particular
Mars bar?
When bad food is cheap. So processed food is so cheap these days compared to good quality food.
Yeah, whereas actually food with good nutrition has not really decreased that much in price, but fast food, cheap food are just getting so cheap that we consume more of that. In the sense that I can easily order an extra packet of rice, which costs me 50 cents to $1. But that amount of rice, I would need to run for an hour just to burn it off.
Yeah, exactly. So, I read this interesting statistic that said that the rate of diabetes in China had gone up just in the last 20, 30, 40 years from like 1% prevalence to up to 11% prevalence. And that is a crazy statistic. And I mean, it's clearly multifactorial, but I think you've hit the nail on the head with the fact it's a complete change in lifestyles from being sedentary and then kind of focusing on cheaper, faster foods. And we've shifted away from a kind of whole food diet as well. So when somebody gets diabetes, so if I'm at home and maybe I'm getting a bit thirsty, what other signs should I look for? How would I know that I've got diabetes?
A lot of patients have no symptoms. About 50% of people, half of them. Especially for the patients who have much higher levels of blood sugar, they will present with tiredness because the sugar is not getting into the cells. They will present with frequent urination because the high sugar forces the kidneys to pass out a lot of urine to pass out the sugar. And then because they lose sugar, they also feel thirst. And then because the cells are unable to process the sugar, they would also lose weight. So weight loss, thirst, frequent urination, and tiredness, and especially this craving for sweet stuff.
Yeah.
In very, very, very serious cases, one gets into coma, acidosis, but those are very rare. Generally, people will have a bit of thirst, and sometimes some people would describe that they see ants in the toilet that is actually gobbling up the urine, and that is sometimes seen when there's unrecognized diabetes.
Really? Okay. And so if someone thinks they've got these symptoms, they should just go to their doctor and get a blood test. What's the common test? Fasting blood glucose, is that enough, or do they need a tolerance test?
Yeah. So the gold standard of diagnosing diabetes is a blood test, which is either fasting blood sugar that is more than 7.0 millimoles per liter, and symptoms. So if you have symptoms, you need only one test to confirm the diagnosis of diabetes. If I have no symptoms at all, then I will need to have 2 blood tests to prove that I indeed have diabetes. That picks up most of the people with diabetes. Sometimes, as in people with who are pregnant, ladies who are pregnant, and we're trying to pick up gestational diabetes, sometimes we do oral glucose tolerance test. So sometimes we feed 75 grams of sugar. So we do a blood fasting sugar before, and then feed the patient 75 grams of sugar. And then in 2 hours time, we check the level of blood sugar again. And so if the 2-hour level is more than 11.1 millimoles per liter, that also constitutes diabetes. So symptoms plus 1 blood test or 2 blood tests roughly 2 weeks apart. So that constitutes diabetes. The Singapore Ministry of Health has also recently recognized the use of HbA1c as not only a monitoring tool, but also a tool for diagnosis. So HbA1c is this hemoglobin particle that has sugar stuck to it. Hemoglobin particles are the red coloring pigments that are in a red blood cell that carries oxygen. And so when there's high blood sugar in the blood, those sugars would get stuck to everything, including the red blood cells, into the hemoglobin at this particular position called A1C. So normally there should not be more than 6% of the hemoglobin particles having a sugar molecule attached to it. In people with diabetes, more than 6.5% of those hemoglobin particles would have sugar stuck to it. So we can take the fasting, we can take the 2 hours, we can take the HbA1c plus symptoms, or 2 sets of blood tests without symptoms.
I heard there was is there an issue with thalassemias and HbA1c? Does that alter the ability to detect diabetes?
Used to be, but
Okay.
now our laboratories are very good. We use HPCL, which is a very good kind of, we identify, so we can actually very safely eliminate those abnormal hemoglobin bands. And we just look at, those A1C. So whether your hemoglobin is here or hemoglobin is there, we can still look at the peaks. So now it's much more advanced, and the manufacturers of the laboratory equipment told us that, well, now you don't need to worry about thalassemia anymore. So it's much less.
So it's not an issue. It's not an issue anymore.
Yeah.
And so if you have diabetes, this is the big thing. Why is it so bad to have diabetes?
Oh, diabetes can cause those symptoms when the diabetes is uncontrolled, but long term, it causes many different kind of side effects, complications. So we generally group them into the macro versus the micro. The macro are the things that, like, people with diabetes have high risk of heart disease, and stroke, and sudden death. And then, so those are important to prevent. Then the other micro are the problem when the high sugar level damages the small organs, like small blood vessels, small nerves. So in the eyes, it can cause bleeding, blindness. Diabetics have increased risk of glaucoma, cataracts, and then also the kidneys. And first, the high sugar would damage the glomerulus, the small functioning units of the kidneys, and then causing leakage of protein. So we always check the urine for microalbumin levels. And then subsequently, the kidneys start to fail. And diabetes has become the #1 cause of newly diagnosed end-stage kidney failure regarding dialysis in Singapore. And the third thing is that sometimes the diabetes damages the nerves and the blood vessels in the feet. And if the feet get infected, sometimes, despite, sort of treatment with antibiotics and all that, amputation is a real risk. So to prevent all these complications, the most important thing is for us to control the diabetes well. And I usually tell my patients this: if you can control the diabetes well, then you won't develop complications. And all these efforts that you've sort of made throughout the years, controlling the food, avoiding the sweet things like soda drinks, bubble teas, desserts, and all that, it's going to be worth it, because you're going to live, your life to 90, 100 years.
You're going to have a much better quality of life when you're older. I mean, what we do, and everything we do, a lot of the heart conditions we deal with are driven by diabetes. And, a little bit more prevention earlier on in life can often prevent all these bad things like strokes and heart attacks and heart failure that we see. So, moving on to that, if for everyone in the public, how can they prevent diabetes, and how can they protect themselves? What are the kind of key factors that they can change in their lifestyle to prevent the development of this disease?
Well, we would always emphasize the importance of exercise, and the gold standard would be 150 minutes of exercise every week. And so it works out to be about, if you exercise 30 minutes a day, it's 5 days a week. And what kind of exercise does it matter? Well, a study has been done, and we've managed to find that if you do a bit of cardio and you also do a bit of weights training, that gives the best results. So probably if you have only half an hour to spare, half the time you should be doing cardio and the other half should be doing some weights training, because muscle mass is important. An increase in muscle mass, muscle bulk, would enable the muscles to take up more sugar, so lowering the general blood sugar level. So that's number one. Number two is to eat a healthy diet, avoid simple sugar, so sodas, any sweetened drink. I noticed that when in my own family gathering, if you're going to have a family dinner, we used to buy these PET bottles of sweetened green tea. And I calculated I must have drunk like 5 cups throughout the night. And I was calculating the sugar, and that's quite a lot. And then we have durian. So certain fruits we should avoid, especially durian. Yeah. Because durian is so sweet, the equivalent amount of fruit sugar in 1 apple or 1 orange is equal to half a mango, but only 1 durian seed, the flesh of the durian seed. Wow. But of course, when I buy durian, I don't know whether, Michael, whether you've tried durian. It's really nice.
I've tried it. I'm not a big fan. I'll admit that.
You're not. Yeah. So, but I can easily eat 6 or 8. So at one go. So those are the sweet things
A lot of sugar.
And because I like it, because it is so bad to me, I force myself to buy only the best quality of durian once a year.
Yeah.
So just once a year, and I'm not going to sort of take too much of it. And then, of course, if we can order tea with milk without sugar, coffee with milk without sugar, and avoid soda drinks and drink the green tea that is unsweetened, etc., that would actually cut down a lot of sugar from our diet already.
Yeah.
So avoidance of simple sugar is very, very important. And beyond that, sleeping early and sleeping enough is very important. We find that people who work night shifts, people like us maybe, who has to wake up in the middle of the night, or who don't have enough sleep, would have a higher risk of diabetes, heart disease, stroke, and sudden death as well. So sleep, so play hard, work hard, sleep hard.
Yeah. Anecdotally, Daniel, when I don't sleep, and if I find myself having only 5-6 hours sleep one night, the next day I crave carbohydrates. I can't stop myself. I'll be eating cake and sugary drinks. And so it definitely has an impact. Sleep definitely has an impact. And I think in Singapore in particular, people do not get enough sleep here. They really they run on 6 hours sleep a night. It's a habit that you need to change.
Sometimes I tell my patients that they should really leave their smartphones, smart devices in the living room, and then they just don't bring them into the bed.
Yeah. It's that blue light, isn't it? If you use the blue light before bed, it kind of interrupts your ability to go to sleep.
It's something to do with the hormones, yeah. So the blue lights will suppress the sleep hormone melatonin. So therefore, we don't feel as sleepy. So as long as we are looking at the phone, we don't feel sleep, but actually we are very tired already. A much better alternative is a good old paper book. And I guarantee you that 2 pages into a book, you will just feel so sleepy and you'll be able to sleep.
A paper book and a normal alarm clock that doesn't involve your
normal alarm clock.
Standard alarm clock.
Exactly.
There's one question I had. So when you got a new patient with diabetes, how do you decide if they're type 1 or type 2?
People with type 1 diabetes usually present in a very dramatic fashion. So usually the damage is sudden, and they'll have a sudden loss of the ability to make insulin, and they will get very sick. They usually present with ketoacidosis, and they will end up with breath that smell like acetone, and then they are very, very sick, and they usually have fever, some kind of infection, and they're children or teenagers, so they usually pick up in the emergency department, and they should check the blood sugar is very high. So most of the time, we don't see that in the clinic. Most of the time, and anyway, type 1 diabetes is only 5% of all the diabetes in Singapore. So much more commonly, we see people with type 2 diabetes. As I mentioned, half the patients do not even have any symptoms. And then the other half may have mild symptoms. And sometimes we may attribute the thirst to weather, hot weather, Singapore being very hot, etc. So sometimes it is really, most of the time, it's really easy to tell apart the two.
Yeah. There's young patients that present acutely and they're quite unwell and more likely to be type 1. Type 2 that tend to be overweight, abdominal obesity, visceral fat, that kind of thing. Okay. Yeah,
people with type 2 diabetes are older, fatter. Patients with type 1 diabetes are normal weight, and then they're young, much younger.
So what do you, so let's just say people have been probably reading the press about intermittent fasting and low carb diets. What do you recommend for your diabetics? What kind of diet do you recommend to control diabetes and also to prevent diabetes?
I think there are two. The two, I would sort of separate them a little bit. There's intermittent fasting by Dr. Daniel Wai, who's a Canadian nephrologist, who first recommended fasting as a way to treat diabetes. And he has since published some papers, although the numbers are quite small, about 5 patients to 10 patients per paper. But what he found is that intermittent fasting is able to help control patients' diabetes. But the caution is that sometimes they would go low sugar, hypoglycemia.
Yeah, exactly.
So his advice is that if you have diabetes and you're going to embark on an intermittent fasting diet, please tell your diabetes doctor, and some adjustment of medication is probably required, especially if you're doing it like a day off, day on, 1 day fasting, 1 day eating. Especially if you're doing that, you might need to have different doses of medication on the different days that we're eating versus when you're not eating. Whereas when you're doing the 16/8 or 24, the kind of restricted time frame intermittent fasting, then the amount of change of medication may probably be less because you're still eating just in a more compressed time period. Nonetheless, please tell your doctor who's managing you if you're going to embark on a special diet. So that's intermittent fasting. And when it works, it's beautiful, and patients' diabetes get much better, and the requirement for medication is reduced. In fact, it's so much so that sometimes they get low sugar. And then we have the other called low carbohydrate diet. Low carbohydrate diet has been much more studied, and the current status, as at least according to American Diabetes Association, is that it is potentially a useful way to help patients control diabetes. So what happens is that we have three big food groups, which is carbohydrates, which is all the sugar and the starches like rice, noodles, potatoes, and all that. And then protein, like meat, tofu, and all. And then fat, which is everybody understands what fat is. So of the three, they recommend that you take much less of the carbohydrates. So that has been more carefully studied. But nonetheless, I usually advise my patients don't do the full ketogenic diet, which is advising patients to eat a lot of fatty pork, a lot of fatty food, fatty beef,
like
fat everything,
fat, low carbs,
and add butter to the coffee, that kind of thing, because that would increase the cholesterol tremendously. I've seen patients whose cholesterol increased by 50, 80%. I don't know whether,
honestly, Daniel, I've seen the same thing. Patients that have gone keto and they have, not all of them, but some of them, just their cholesterol's gone sky high. Up to almost 80, 90% increases.
Yeah. In fact, Dr. Atkins, who first propagated this diet, had warned that in about 20% of his patients, the level of cholesterol would increase quite alarmingly. And he said, please check with the doctor. So I usually tell my patients that you please do not increase the amount of fat. Just eat normally. So it's like mixed rice and vegetables, but without the rice, or less of the rice if you want to go for a low carbs diet. That has been shown in some smaller studies to help improve, because obviously if diabetes is a state that I cannot handle carbohydrates or sugar. If I don't take those carbohydrates and sugar, then I would not exhibit high blood sugar. In fact, that is how we used to help the patients with type 1 diabetes to be kept alive before the invention of insulin. So they're not allowed any heat drop of severe sugar restriction. But low carbs diet or intermittent fasting is not for everyone. They are diets that are particularly difficult to keep for Asian people because we like to eat. And if I go 3 days without rice, I generally have some problems. And when I'm in Europe, we always look for Asian restaurants to have some rice. So it may be very difficult. A lot of my patients tell me that they can do it for a short while, but they can't do it for longer than 6 months. It's really hard because when they meet together, their mom or their friends have prepared this nice bowl of nasi lemak or noodles. And then you say, I can't eat it. I can only eat all the meat inside, and everybody's going to throw stones at them. So it is very, very difficult. And it's, of course, slightly more expensive because the meat and the protein stuff are more expensive than the rice. So, but if you are able to keep at it, and if you do it sensibly, like you just sort of remove and not add in any fat, I think at least, in the studies and in some of my patients, it does help reduce the level of blood sugar, but it's not everybody's cup of tea.
So kind of keeping it simple, removing, first step, I guess, is removing all the simple sugars from your diet, all the sugary drinks and sweets and cakes, and then, reducing rice as well. Okay, Daniel, I think we're probably up to our time limit now. You got any short summary of diabetes, or key advice for people trying to avoid getting diabetes in the future?
Well, the simplest thing is after you watch this podcast, go and have a run. Let's go exercise.
And don't have a sugary drink afterwards.
No, it's just water. Yeah.
Okay, Daniel, I really enjoyed that. Thank you very much for coming on today and talking about diabetes. Yeah, thanks very much.
Yep, thank you, Mike. Bye-bye.